Good morning, everybody. Happy Thursday and welcome. Today's class, I'm actually going to, and don't worry, you can't see anybody other than me on here, send this video over to someone to evaluate editing it. So you'll notice I'm saying things that you already know or things that you maybe haven't heard before. It's just for the sake of having this individual evaluated. So I'll give my recommendations that if your medical team has advised you against exercise, please confirm with them that it's okay for you to go forward in this class. If your medical team wants to see what we're doing, I do have some videos on my YouTube channel, carolynvanslow.com, and you can show it to them. So we're going to do something interesting today. I have a couple of new exercises in here. You'll need a block if you feel like you have unstable hips. Okay. I happen to have them, so I know I need the block. But we're going to do a little bit different approach to the Diva Pose today. We're going to do an active Diva Pose. If you're not able to do it, when we get to that exercise, I'll make the explanation then. You may need a decorator pillow. I think the block will be too high. I wouldn't do it with my hips with a block that thick, but others may be able to. I just happen to have really tight hips. So we're going to start today against the wall with shoulder rolls. And when I explained earlier that we were going to need a decorator pillow or a block for the unstable hips, I'm going to use this because I get unstable. I know you find that hard to believe, right? So when we do our first exercise, if you're not going to use the block, that's fine. But I recommend getting close to the wall. So you want to use the wall as a way of cueing you and letting you know, hey, is my shoulders close to the wall, my back end, my heels, all of that. It's a way of seeing what's going on, because maybe you're a little bit rotated, you may say to the right, and you can feel the right shoulder, but that left shoulder is missing. So what we're going to do with this, I'll demo in front of you, feet 6 inches apart or hip width, because some of us have smaller hips than the 6 inches. And when you do the shoulder rolls, I want you to keep your hands, the inside of your hand, palms facing the outside of the thigh, and you want to keep your shoulder, or excuse me, your elbows locked out, because if you're moving your elbows like this, you're not really getting the education to the shoulders, and you're not really finding out just how tight they are. We're going to do 25 forward like this, and I'm raising up and bringing my shoulder blades together. I'll show you from the back. See how I'm doing this? I'm raising and pulling them down and going up. And then we're going to go backwards for the second set of 25 like this. And you might hear a lot of snap, crackle, and pop in one direction, but not the other. So just go forward and don't be afraid of the noise. If you're experiencing pain in the joint, discontinue the exercise and wait for the next one. So let's go forward 25 times. And just roll those shoulders forward. If you're unable to get your head against the wall without raising your chin, do not put your head on the wall. Your neck is not ready to do that. So in this class, we always do what we can do and add a little sprinkle of challenge. We don't want to go forward and force something to where we're causing pain or dysfunction. I will tell you that there are certain exercises that we do to force action, but this isn't one of them. But when I hit on one of those, because I've never really told you guys this, when I do hit on one of those, I will tell you. And when you're done with the 25 forward, then do 25 backwards. Just go along and raise up and roll and bring those blades down and together and just get them moving. This is a great exercise. You could do this in a chair at work. You would just get yourself into that anterior tilt by lining up your hips through your feet, rolling your pelvis forward, sitting on your chair. And you could do a bunch of these on a chair. I do that because I get real stiff from sitting, sometimes even short periods of time. It seems like my body does not like sitting. So let's go ahead, and when you're done with that, that's great. And now we're going to do what is called locked shoulder glides. And we're going to do 2 sets of 12 reps. We've not done this before. So when we do it, I'm going to show you here, then I'm going to show you on a wall. We're going to put our hands together and we're going to bring them up here. Okay. Now, in an ideal, perfect world, we would love to see those elbows go back to the wall, but they don't. Let me take this picture down so I can have you see what I'm doing. You're going to do the best you can when you do this, okay? So you're up here. As you can see, I cannot get my elbows on the wall. This is what they look like from the side. You can see they're not going back. Some of us have activities and sports and so forth that tend to do a lot of rotation this way. And most of us are really tight this way. So that's why this is in here. So when you go on the wall, you're going to go 1, see how I'm moving? I'm keeping my hand on the wall like this, and I'm moving back and forth. Now, I practiced this exercise before I did it today, and I'm definitely a candidate for trying to learn how to do it better. So if you find that you cannot touch the wall with your elbows, just keep them pulled back. And we're going to do 12 twice. And that means 6 in each direction. You'll feel work in the shoulders. Be sure and try to hold the palm together. It's real hard. I can tell you, I may be teaching this, but I'm struggling as a student doing this. And I'm just going back and forth. And you may experience, do this 12 times, 6 on each side. You may experience tightness in the neck, which is telling you really how tight your neck really is. And you may feel it in the low back because of the position. And of course, you may feel it in the backs of the shoulders because trying to get those shoulders back with your hands up over here, for some of us are tight. And that's because we're really tight in this forearm from a lot of flexion from phones, computers, life, sleeping in fetal position, all of that. So let's do the second set. Hands against the wall. Remember, if you can't get the elbows there, just try to keep the hand on the wall going back like this. Now, you may be noticing now, you're getting more range of motion. You're still probably feeling where the tightness is. I described to you some of the areas, but you may be experiencing something else. So just do your 12 and go back and forth. I think this exercise is very challenging to people that have a tendency to have the shoulders rolled forward, internal rotation. It's hard. But I'm sure you can see by the second set that you were able to move more. You might have felt more pulling, but you were able to move more. So I think this is a great exercise for us to continue to see in our exercise therapy classes, because I can tell you I need to do it. And I'm also one of those people that is really guilty of all the reasons why we need to do it. So now we're going to do scapular contractions. I like to do it against the wall, and I like to have the clients do it that way because, again, we're going back to the cueing and how well are those shoulders touching the floor. Make sure you don't have a bent knee. feet 6 inches apart, heels against the wall. And you're just going to pull those shoulder blades down and together. Now, when you do this, you want the palms facing the outside of the thigh. We're going to do a set of 30. Now, while you do this, just pay attention to what is happening to those shoulder blades. Does one seem like it doesn't move as well as the other? If it does seem that way, just, pay attention to it. Notice whether or not you can feel them. People that come in and tell me that they can't feel a body part, a lot of times I know that they're very, they're shut down. I've heard one term, amnesia, and there's something to be said for that, because the body doesn't remember how to do it, because we've had this position, we've been locked into it due to our work, our activities, the way we walk around and stand. A lot of us will get exercises that are excellent for upright position, and you'll do an excellent job on it. But then the minute you start walking around, you start walking with your body rolled forward again. And that is partially a bad habit, or you may have some tension, possibly in the hip flexors, and we need to look at that too. With posture, a lot of us think we just have to pull our shoulder blades back and stick our chest out, and then we're fine. But the truth is, your bad posture might be coming out of the lower part of the body, where there is more muscle tension on one side than the other. And we wouldn't know that until we went to stretch that muscle out. So just keep moving, pull those blades together, do the very best you can. And when you're done, just relax. And now we're going to do the static extension position, but this time we're going to do it on our elbows. I'm going to teach it a little different this time and see if maybe we can all get more benefit. So I'm going to show you, I'm going to, lower this so you can see me on the floor. We're going to do it on our elbows today. And the way we do that is we're going to set up very similar to the normal static extension, which is this one, and you go like this. But today, we're going to focus on the upper part of the thoracic back and the shoulders, because the past 3 exercises we did were focused on, getting more range of motion, opening it up. I've worked around too many massage therapists. I tend to use that lingo. So when you do this, you're going to walk yourself forward like we've done in the past. I recommend walking about 6 inches if you're somebody that has really short arms, i.e. the instructor. I walk about 4.5, okay, because I do have short arms. Then don't worry about your hips. You're going to drop down. You'll naturally be in a lot more, you won't be in the hip flexion as tight until we make the move. Now you're going to make a fist and you're going to pull the arms out like that. And then you're going to pull backwards until you feel your thoracic back. Probably, if you can see me, from about here up to the shoulder, you're going to feel it engage. Now, some of you are going to feel more work in the shoulders, and some may feel more in the probably the mid trap, possibly lower trap. And that's more than likely where you have muscle tension. And I do see that a lot. People come in and they tend to stabilize up here, and you'll see them do that. So what we're doing is we're working on getting more range. We're trying to get your thoracic back into extension and basically get those muscles to relax so they don't feel like they have to turn on and then you have to take that position. So we're working our way into more efficient spinal loading. So you're going to walk forward. Then you're going to drop down onto the elbows. We'll be here for 1 minute. We get everything set up so we don't have to be tortured too long. Now your arms should be like this, about shoulder width apart. Make your fist pull. When I pull this out, you're going to feel those shoulder blades move. So I'm going to make sure I walk forward. I just caught myself in the camera and I am not forward enough. So now arms out. So you're going into external rotation, and then you're going to drop your head down and you're going to begin pulling your hips back until you feel the work from about a little higher than the mid back up to the shoulders. That's where you're going to hold. So go ahead. Try to pull those shoulder blades together. It may not feel like you are, but you should feel the muscles engage. If you don't feel the muscles engage, it just means that we need to re-educate them because they have a tendency to get a great memory as far as going back to the wrong position. So I'm pulling back with my hips and I'm feeling a lot of work from about the 1/3 of my back up to the bottom of my neck. And I'm feeling that work on the shoulders. Be sure those arms are pulled out. That forearm is pulled out. And relax your tummy. Relax. I'm pulling back with my hips a little more because my body is beginning to engage on the upper part. So I'm getting some positive feedback. Okay, you're going to come out of that. And I'm pretty sure, stay down on all fours because I think, yep, cats and dogs. Okay, so we're going to do about 10, 12 cats and dogs. We haven't really done anything to the hips yet. So the way it'll be interesting to see what you feel, or to feel what you feel, not see it. So when you do cats and dogs, again, we want the hands shoulder width apart, and we want to initiate the movement with our hips by pulling the tail under, and then the opposite way, pushing that tail out and pulling those shoulder blades together. Now, when you pull these blades together, you're going to feel some of the residual stuff we learned on the last exercise. You may feel like, hey, my shoulder blades are coming together a little easier. So we're going to do 10 of these. So just notice, is there a difference when you go into the dog and pulling those blades together and looking up? You might have more range of motion. You might feel like things are moving a little and gliding a little smoother. And you may not notice anything. And all of the above is correct. There's no right or wrong unless you're just out and out doing something wrong. But with this, we're all at a different level. Pull those blades, really get benefit. You worked hard on that static extension on elbows. That is not an easy exercise, especially for those of us that are in the golden years. And we've acquired so much stiffness. That's the one thing we want to avoid, is the stiff joints as we get older. I've seen this in an advanced cases, and it's just, when I work with people like that, I just wonder, gosh, if they fell over, they'd probably break elbows, shoulders, everything, because they're so stiff and they've lost range of motion. You wonder, how do they get along? How do they get around? And when you're done, just relax and congratulate yourself. because you did a good job. So now we're going to do, let's see, what do we got? Oh, our old buddy knee drops. So this is leading into something. We're actually going to stretch our hip flexors before we get into the active diva, or if you're not able to do active diva, then the diva pose. So I'm trying to open up everything around it so it'll make it easier for you to do. So with knee drops, we've done these before. We're going to, I like to pull the feet apart. You can see I'm not, that's hip width. This is wider than hip width. And you can put your elbows, or excuse me, your hands on the floor. If you, I want you to try this out. If your palms up, just notice where your shoulders are, then go palms down. And you feel that change in the shoulder. Palms up, you can feel it's flat. And when you go down, you can feel that it's moving. It's moving away from the midline. So let's go palms up today. And what you're going to do is you're going to rotate to the right, turn as your head is turning to the left. I like stretching the multifidus muscle, and that runs from the top of the neck all the way down to your tail. And it's a very overlooked muscle until somebody notices it's not working right and they teach you how to activate it. And then all of a sudden you're like, wow, some of my pain went away. So let's do 30 of these, and you'll see I'm not pushing through. I am allowing my body to just gently go into these positions, because this position that we're doing is actually, we do quite a few things with this position. We are stretching our inner thigh muscles, our adductors, and we're rotating around the ball and socket. And of course, we're stretching our lateral stabilizers, which are on the outside of the leg. So let's do our 30. Take your time and allow these muscles to lengthen, because they're going to need to lengthen more in a few minutes. So that's why you've probably noticed that I will use this exercise prior to something else. And I do it because some of us in this class are a lot tighter than others. And we can do the work. We just need a few little things to loosen us up and get our range of motion improved so that we can go into the next exercise. And that's very rewarding, because you can now do something that maybe you couldn't do a couple of months ago. And notice how you feel. And I'm talking, so I can't do it as much, but I would really encourage you to do deep breathing. As you deep breathe, those muscles, especially when you're in the down position, and if you deep breathe in, pull the air to the low belly and come around, you'll notice you start to gain more range of motion. Some clients are, they just have a very quick sympathetic nervous system. And those are the ones that never sit down. I'm not one of them. So they will want to try and go faster. And you lose value to what is re-educating your body. It's hard when you're wired to be an Energizer bunny for somebody to come along and try to slow you down. But it also adds balance to life. Another thing too is a lot of us have been trained to breathe in through the nose, out through the mouth. I always suggest trying breathing in the nose and out the nose, and give it give it 3 weeks before you make a decision, because it will make you more, gosh, I sound like Nevada Energy, but more energy efficient. Takes a while, but it will make you more energy efficient. And it also activates our parasympathetic nervous system, which we need it right now because we're trying to make some structural changes. And you don't make them running 100 miles an hour. So just keep going. And when you hit 30, let's throw in some pelvic tilts right after that 30. And pelvic tilts, I run across a lot of people that have what I call amnesia in this area. And you just want to roll that pelvis forward and then roll the pelvis back. And you'll feel when you roll forward, your back is going to come off the floor. Don't try to hold it there. Just let it come back. And when you roll it the opposite way, which is towards you, which is a posterior tilt, you will feel that back go to the floor. What I like to do in my own journey for myself is determine whether or not my range of motion with my pelvis is allowing my low back more flexibility, range of motion. So that's feedback, and it should be feedback for you too, because it's almost a given nowadays. Everybody comes in with a tight pelvis, particularly on one side, and we all got tight shoulders, more so on one side. And so what this is doing is it's getting us to use those muscles now when we've taken some of the tension out of the muscle, and we're going to take more in a minute. So when you're done, just do about 10 and just relax. You can come up now. We're going to do, and my mistake, I forgot to tell you, you are going to need a chair if you want to do it. We're going to stretch out our hip flexors. I like to use the elevated hip flexor. It helps with balance, but if you're not ready for that, no worries. You'll do it on the floor. I'll show you what to do. So if you're not going to do the elevated stretch, sorry. There we go. Now you can see my head. So the elevated stretch, you're going to put one foot forward. You're going to bend. If you feel that you have a lack of balance, do it close enough to a wall that you can. I've got my left hand over here. And then you're going to straighten out that back leg. Make sure that your foot is straight ahead. And you're going to go about it this way. Now I'm locking out that back leg. And I'm feeling today a lot more calf work than I normally would. And that's because of what I did yesterday. So I'll show you again. Go forward. Some of you are not going to get your heel on the floor. Do the best you can. Lock out the front of the leg, and you'll feel the pulling. The elevation, I like to do this on a chair. This is not the ideal thing on a carpet, but I'm not going to go get a chair right now. So I put it against my couch. I personally feel like I get a better stretch this way, but we're all different. So if you came into my office, we might try both. Maybe you felt like you got more action on the other one. So you're going to go forward, lock out that back leg. Now, normally I teach you when we do them other ways to push back. Today we're not. We're just going to go forward. We're going to lock out the front leg. Make sure that your foot is facing forward. That's really, really important, because if you turn your foot out, you're not working on your hip flexor. You've now switched over to one of your adductors, which is your inner thigh. We'll be here for 1 minute. And if you can't do 1 minute, just try to do both sides equal. Maybe count. Okay, here we go. Lock out the back leg, the front of it, and you'll notice the more you straighten the leg and tighten it, the more pull you're going to get on the front of that leg. Now, some of us may have an unstable side. My experience has taught me that when you have the unstable side as the back leg, you're going to feel a little bit more like you could topple over. Your balance may be challenged. That's why I always say, have something close by. Sometimes I have my baby finger. I probably have maybe an ounce of my weight on that baby finger, but for some reason, and I think it's psychological, I feel more confident. And then I quit wiggling. Now, this is my unstable side. So this is when this leg is back, I know I'm in for a challenge and come out of it. So you may notice that too. And then on other days, you may find that it switches. Like one day, one side is wiggly, the next day, the other side is. We are always changing. Posture is always changing. Okay, make sure that back foot is forward. And oops, let me get this ready. Okay, go into position. Lock out the back leg. Make sure that that foot is straight ahead. And I just got mine, it was out a little bit. And you'll notice when you straighten the foot out, you'll get feedback up in this groin, in the quad and in the groin, because the hip flexor goes from the inner thigh, the bottom of the groin there in the inner thigh, all the way up underneath that 12th rib. So if you're in the wrong position and then you straighten your foot out, you may be like, whoa, I only moved my foot maybe a half an inch, and this is a big difference on what I'm realizing is happening on that downside, the foot on the floor. Just do the best you can. Don't forget, relax your belly. We always have to relax our bellies. Okay, good. Come out of it. All of our exercises, unless I make a specific command, like we're going to use our tummy, we really want to focus on relaxing that belly and getting it out of the picture. There are some modalities out there that talk about keeping the core constantly activated. I will share my experience with you. I've done it both ways. I have found personally in my postural journey that not activating my tummy during a postural exercise, I'm getting a better result. Now, in sports, especially if you're a weightlifter, you have to activate your belly. Some of us do what we call bracing. And bracing includes pulling the tummy in and pushing out at the same time when you're lifting weights. And there's some people that do that for particular things like a squat or a deadlift, or you may find it works good when you do lunges too, because you might need that. Also, if you're someone who's had back injuries, learning to activate that area is really important because this is your natural weight belt. So now we're going to do the active Diva Pose. If you're not capable of doing it, and you'll know the instant you try, and your body's just not ready to do this, then you're going to stay in the Diva Pose. So we'll start with the Diva Pose. And this is what it looks like. You're going to roll your hips forward and sit like this. I'm going to let you see it from the side. Here I am. Now I'm going to roll my pelvis forward, and I'm not putting a lot of weight on my back. Now, I can feel a lot of activity in here, and that's telling me there's some really tight muscles. So if you're going to, that would be the Diva Pose. What I would recommend is it's normally we do the Diva pose between 30 and 60 seconds. So if you're going to do the active Diva, what you could do is every time we switch sides, you could go back into the Diva pose, and then because it's going to run fairly much the same on both sides. So now if you want to try the active, you're going to put that leg that's facing down, the inner thigh is down, like so. And what you're going to do is you're going to go into the Diva pose, and then you're going to press 2, 3, 4, like that. You're going to feel those muscles loosen up. Now, some of you may have trouble with the Diva pose, but you might do really well with the active Diva pose. So bodies are a mystery to me, and I think it's fun to find out what they're going to do. So let's go ahead and give this a try. If you're doing the active Diva, we're going to do 3 sets of 10 reps. So we're not going to go crazy. We don't want to go too fast because momentum doesn't teach you anything. So you're going to go into position, roll your hips forward, you roll that pelvis forward, hands behind you, not too much weight, upright, go into extension in the spine. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we'll go to the other side. If you're a Diva pose person, you might not change until after we complete this one. Same thing, just like this. I got one foot against this knee. I'm going to put my little pillow underneath there and roll my pelvis forward in 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, when we do, let's do the next side. When we do wall splits, which is coming up, you'll notice that some of these muscles close to the groin are working, and they're also stretching as you press. 2, 3, 4, 5, 6, 7, 8, 9, 10. So you're going to feel, if you're tight in that area, you may feel a lot of pulling right around that groin. And you may feel it other places depending upon, go ahead and roll your pelvis forward, 10, pressing down. You could feel it other places too. It just depends where the tension is, where the muscle tension is. And we're all different. Remember, roll that pelvis forward, upright, not too much weight on those hands. Last set. Don't worry about keeping up the numbers. Even though I said to do 10, maybe you're just learning this exercise and 10 is out of the question. What you want to do is you never want to sacrifice your form to try to keep up with me or anybody else. You want your form to be perfect, and don't worry about us, worry about you. Roll your pelvis forward, this last set, 10. What I like about this is it's making me use my hip in a little bit different position, and yet I'm still activating and moving. My assistant just came in. You can't see her. She's hiding behind the block, but she's been my office assistant for 14 years. Whenever I work in my home office, there's the cat. Okay, roll that pelvis forward. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now, my question to you is, where did you feel it? On the right side or the left side? Maybe your right side felt different, and your left side, maybe you didn't feel anything there, but the right side was tight. That's giving you some information, and it's valuable information, because if you came into the office or we did something on Zoom and you told me that, that's a clue of knowing where to go in your program. So we always want to keep a little running list in our head with these clues. Doesn't mean anything is wrong. It just means that's you and that's your imbalance. So now we're going to go to the wall. And this was brought up again. I take a lot. I knew about it, but it came up in our mentoring session about when we do static wall and we just don't have that range in the pelvis, hamstrings, then go there, but just keep the legs straight. That's what's important, is keeping the legs straight and locked out, because it's still in its own way. And I told you about forcing. It's forcing that leg to, it's actually forcing the pelvis to rotate around the femur. And that's what we want. We might just take a little longer to get there. That's all. There's nothing wrong. I'm telling you, if I brought in 6 NFL players, you guys would say, oh man, these guys are a mess. I'm better than them. So we're all different, and our level of activity is going to have a big, big influence on our range of motion. So let's go and put our legs up on the wall. If you are not able to get against that wall because you don't have the range of motion, take it all the way to where, yeah, you're feeling it, but you're also keeping this leg locked out. It's real important to keep the legs locked out and the feet flexed. So I'm going to pull up against the wall here. Now we're going to go to wall splits like this for 1 minute. We're going to lock out this leg. What I want you to do is flex your feet and turn them in just a skosh. That's an old word. Skosh, tad, and snitch. Turn it in just a snitch, just a little bit. And you'll notice that even if you're away from the wall, you'll be feeling activity, not just the inner thigh, but you may be feeling a little hamstring activity too. So it's just wherever you're tight, and just relax the belly. And you'll notice if you relax your belly, your back's going to get flatter on the floor. And deep breathe and just allow those legs to open up if they want to, and keep the foot flexed and the quadricep muscle tight. You want to get it real tight, because when you tighten it, as you can see or feel, you're going to know that the back and the sides are having to stretch a little bit more efficiently because of the fact that it is tight, because we're doing we're using our own bodies to challenge the tight, this is called the antagonist. We're challenging it by tightening the front. It's going to cause the back to begin to stretch. And we're going to do that again. We're going to get some reward from doing this today, because we're going to do one of our second to last exercises is going to involve the range of motion of the hips and the hamstring. And hopefully you're going to get a real pleasant surprise from the last time you did it. Okay, come out of that. Now I want you to stay in that position. If you need to scoot closer to the wall, because now you can, but maybe you're not ready to go all the way against the wall, just go ahead and do that. You're going to flex the feet again, tighten the legs. I want you to interlace your fingers, put them behind your head. And I want you to relax your shoulders, let your elbows touch the floor. I recognize that some of you are pretty tight and you may not be able to quite touch the floor. Do the very best you can. Now, what you're going to do, you're going to look at your eyebrows and you're going to come up like this, keeping those elbows as wide as you can. You absolutely don't want to pull them together. You want to keep them pulled away from you. We're going to start with 20 ab crunches. And this, again, is asking your pelvis to increase range of motion and flexion, which is going to help rotate it over the femur, the head neck of the femur. So keep going. You can do 20. And when you're done, take a break. Be sure and look at your eyebrows. And hopefully you can't see them unless you have a third eye, which I understand we do. Relax for a minute. When you're done, you're going to do 20 more. All righty. And let's go into our second 20. And you may be noticing that those legs are getting closer to the wall, or you're capable of getting closer to the wall. Be sure and support that head and neck. You should not be yanking that neck around, pulling that head forward. All your hands are is a hammock for that neck and head to relax. Look up at your eyebrows. Make sure that you're still contracted on those quadricep muscles. Feet are flexed. They're approximately hip width apart, and you should be feeling the work in the stomach. And it's around the belly button, below the belly button, that area. That's your transverse abdominis. Okay, great. Now let's just sit here for a second. And the reason I'm doing this is asking you to stay here for just a minute is because this is in its own little way reducing rotation of the upper and lower body. We've done a lot of lengthening those muscles and getting them to fire a little bit more efficiently. We've increased our range of motion, but now let's work on something that feels passive. It's not that passive, and that's going to reduce the rotation in the hips and the shoulders, or if nothing else, it's going to lock it in. Not the rotation, the lack of rotation. So just breathe, and let's do 3 deep abdominal breaths. And then we're going to go into the next exercise, which will be hip crossover on the floor. So just go ahead and relax, deep breathe, 3 good breaths. And notice, is your back getting closer to the floor? Do you feel more balanced? Is one side maybe feeling heavier on the floor, or do you feel like things are more even on both sides? So just do your deep abdominal breath. Very, very nice. Okay, let's hit the floor for hip crossover stretch. This is going to help increase range of motion in our lumbar spine, which we can all use a little of that. Well, that's not true. Not everybody can. Some have too much, but it's also going to help stretch the fascia. And I'll share something with you. I had on the side of my neck in the back, I had a muscle that was always a little bit contracted. And through doing this type of exercise, it's basically losing its ability to do that because it shortens so much on that one side. I've had a lot of damage on my neck on the right side. So when you do this, I think somebody has come off of mute, and I'd like you to check please check your volume because that is being recorded. Thank you. So when you do this, you're going to cross one leg like a man, turn it over, turn your head as far as you can, palms are down, and push. And you can see I am pushing that knee away from me. Try and turn your neck as much as you can, especially if you're somebody that's lost rotation, but don't take it to the point where you injure yourself. Just ask it to move. What I've noticed with clients that have lost rotation due to too much what we call thoracic flexion, they're very reluctant to do that. And I really have to work with them to get them to do it. And I've noticed that they're increase of rotation. They're able to turn a lot easier. And I haven't really said too much about it. I just keep getting them to do it. And by golly, they're getting better. Their necks are starting to rotate better, and they're complaining a lot less about neck pain. So let's go ahead. We're going to be 1 minute in each direction. So off we go. Turn, foot on the floor. If you're too tight to get that foot on the floor, put that decorator pillow underneath your foot and then proceed. You're turning your head as far as you can. You want your fingers 1 through 5 touching the floor, palms down, pushing that knee away. And as you gain length in those muscles, tendons, ligaments, and everything else, push the knee further. But don't go to the point of hurting yourself or tearing. So just be calm and push it away. I don't know, I'll ask you guys this. If you've noticed, we do this exercise a lot. It's a real good default exercise. And this particular sequence today that I set up, I noticed right away where I have a lot of tension on my left. And when I demonstrated it, it was less. And I'm like, So I'm going to ask you guys, if you notice when you do this, you can come out of it, is some of your little spots, and we all have them. Are you noticing if there's a difference? Because the thing that we did today that was really different was static extension on elbows. So we did affect the shoulders, which affect the hips. Also that active Diva Pose. So I'm wondering if that was real beneficial for you guys, because I noticed a difference for me. Now, roll down into the second position, palms down. Now, I know for a fact this is my neck side, so I'm really going to turn that neck, and I'm going to ask it to work. Now, I've had years of neck issues and neck stretching and everything, so I know I can push my neck a lot harder. But I had to go through exercises and learn that I could do that. If your neck is not ready, only take it as far as it will go and then gently coax it further if it's ready. Make sure you're pushing that knee away from you. And notice when you push the knee away, you may get more range of motion in that upper cervical neck. So just stay in that position. Breathe. And go ahead and come out of that. Now, if you have, I'm just giving you a little FYI. What I notice, and I hear back from clients, if there is tension on one side of that neck like that, when you've actually worked it, and you come out of it, it might feel a little like, reminds me of a squeaky door coming out like that, because you can feel, because it's been in a position and contracted for a long time, or maybe hopefully only a short time. And it just gives you kind of a strange feeling at first. So you just kind of sit there for a minute and relax and let it settle in, because you are asking it to make a change. All right, now we're going to do the modified runner stretch. And I think I'm going to have to pull the cat off of the block because she's on there. We'll see if she stays. There we go. That's my office assistant. You can stay there. No one cares. There's several ways to do this. I like to do it so that we really get good lumbar. And that's how I teach it for this class. But I've also taught it other ways to get more tension and pulling around in this area, and what I was stretching basically. So when we do this, what I shoot for in this class is you're going to put one knee behind the other. You're going to go back up, tighten the front leg. If you can't get the back leg down, don't worry. And then I drop my neck and I release Let my shoulders drop in. And you can see I've got a little bit of a lumbar curve. So that's how I'd like to see you do it. If you go to the floor, I'm going to demo on the floor, same body, but you can see it's different. I don't have as much curve here. If you're a person who has maybe reduced your lumbar curve due to posture, injury, whatever, it's going to be more efficient for you to go up here because you're getting that curve back, but you're going to feel that hamstring and it should be barking at you a little bit. What we're really doing is we're increasing range of motion in our pelvis, and it's going to allow our hamstrings more lengthening. So just go into the position, start down here, come up. Make sure those feet are straight ahead. Tighten that front leg. If you're not able to get your foot all the way down, then stay on the ball of your foot, but keep the front leg tight. And breathe. Just breathe. Keeping that quadricep contracted. Continue your breath work. And notice, you probably can feel it's moving. And sometimes the tension will start high up. And as you progress into the stretch, you may notice there's more tension down towards the knee. Or it could be just the opposite for you. We're all different. Some of us in this class have really good range of motion in their pelvises, so they may feel it very differently. Okay, up. Take a quick breath. Go ahead and set up. Put that knee behind the front foot heel. Go ahead and go up into position. Make sure the feet are straight ahead. Lock out the front leg. If you're not able to put the heel of the back leg on the floor, then stay up on the ball of the foot, but keep that front leg locked out. And just breathe. Deep breaths, relax your tummy. Tighten the front of the leg. Let that neck hang. You'll feel work in the shoulders, the hamstring, the arms, if they're real tight. And just relax. Tighten the front of the leg. Notice when you tighten it, the more you tighten it, things are changing back there. And go ahead and come out of that. Great. You guys did a good job today. I'm sure our shoulders and hips are feeling like we've worked them. I know mine do. So I want to thank you for coming today. I want to remind you that the announcements for the classes will be coming in a newsletter. So if you have a really high security on your spam, you may have to go into your spam folder to find it, and then you can set your system up so it won't be throwing it into spam. But I'm going to just announce through the newsletter. All of you have been entered into that. So if for some reason you don't get it and it's not in your spam folder, I would love it if you would email me and let me know so I can make sure there's nothing on my end and we can find out why you're not getting it. So I want to thank you. And if you have anybody you know that you feel would benefit from this class, please send them a copy of the newsletter or forward it to them and ask them, to join. Anyone in chronic pain or someone that just is feeling like, oh God, I got to move. I just feel like I'm getting so stiff. Anybody you think will get benefit, go ahead and refer them. We'd love to have them. You guys have a wonderful weekend. Our Las Vegas weather is cooling down. I'm ready for that because I want to clean up my garage. Okay, guys, you have a great weekend, and thank you for coming.